Hello and good afternoon, everyone. My name is Nicole Magruder, and I'm the Executive Director of Community Hero Action Group. I am pleased to introduce today's forum, Weeding Through the Facts, the impact of the legalization of marijuana on the Black community. And I am going to start off with our moderator for this afternoon, Mr. David Dix. Mr. Dix is a co-founder and CEO of Luminous Strategies. His passion for politics and public advocacy is made evident by more than 20 years he has dedicated to forging broad and meaningful relationships with Republicans and Democrats alike from across the nation. In his role with Luminous Strategies, David leads the strategic visioning as well as the day-to-day operations of the firm's government relations division. He's a remarkable individual. We're glad that he is here today to facilitate today's forum. And he is going to start off by introducing our panelists very briefly. If you would like to learn more about our esteemed panelists, please be sure to be logged into the conference first and foremost, and you can click on speakers to read their full bios. If you are watching the forum from social media, please note you can make comments from your Facebook or YouTube channel that you're watching from, and we'll still receive those comments. So without further ado, I'll hand it over to you, Mr. Dix.
Thank you, Nicole, and I'm really looking forward to this conversation with such dynamic leaders. We said we wouldn't really get into the bios, but I'm sure throughout the course of this conversation, you'll understand the gleaming representation that's represented today in today's conversation. Again, this is the 2022 Pennsylvania Black Health Matters Conference, and we're talking weeding through the facts, legislation of marijuana and its impact on the Black community. Again, I referenced our dynamic group of panelists. Without further ado, let's just get into it. We're talking about cannabis legislation. Obviously, there's different legislation that's occurred across the country. Pennsylvania is unique in our medical cannabis industry, but haven't yet gone to full recreational. I'm sure Representative Rabb will give us a sense of where that stands. But when we're talking about the Black community in reference to marijuana, I think it's best to start with restorative justice. So I'd like to open this opportunity to Secretary of the Pennsylvania Board of Pardons, Celeste Trusty, if she could talk a little bit and give us some context on the restorative justice aspects of a medical marijuana program and potentially a full use recreational program in Pennsylvania.
Sure. Thank you so much for having me today, David. And so again, I am the Secretary of the Board of Pardons in Pennsylvania, and we have an expedited program for folks who are looking for clemency and a second chance who have former marijuana convictions here in Pennsylvania. So I just want to give a little bit of a history and context about how arrests in Pennsylvania are still impacting our communities across the Commonwealth. So in 2019, we saw nearly 20,000 arrests made in the Commonwealth for possessing less than 30 grams of weed. And yes, that's down from 24,000 arrests in 2018. But when you think about this, think about the hardships that we are still heaping on our communities and our community members. 20,000 arrests in 1 year. And the enormous amount of resources that our communities are pouring into investing in criminalizing a plant. And honestly, when you look at drug arrests in the Commonwealth, those 24,000 arrests in 2018, they constituted more than 40% of all of the drug arrests in the Commonwealth. And there was an ACLU report in 2020 that showed that Black people in Pennsylvania are 3 times more likely to be arrested for possession of marijuana than white people, even though the use is about the same. And that disparity really does range by county. So in Philadelphia, that disparity is 2 times. But in Perry County, which was among the top 20 counties in the country for marijuana possession, arrest rates in 2018, Black people were 28 times more likely to be arrested for possession than white people in Perry County. So we really need to look at clemency as an option for second chances for people who have been impacted by marijuana criminalization and mass incarceration and any sort of criminal conviction in this way. As I mentioned, in 2019, the Board of Pardons created an amazing, expanded, expedited marijuana review program to get people who have marijuana convictions to see the Board of Pardons quicker and to be able to get that second chance from the governor. So far, the governor has signed 300 pardons under this program. And that's 300 people in Pennsylvania whose lives have now been changed and transformed through the opportunity to get a second chance.
I have a couple follow-up questions to that, Madam Secretary. I'm curious about, one, what have we done as a state to kind of tackle this issue of clemency? Is there legislation in tow? Have you been working with the governor or other stakeholders around that issue? And then also a follow-up question to that is, how can we kind of coordinate county approaches to this so that we don't have such drastic disparities between Perry County and Philadelphia County, for example?
That's a really great question. And one thing I want to highlight that are popping up across the Commonwealth are pardon projects. And I know Pulse, which is an amazing organization who really does work on pardons, they're trying to look at how to give access to second chances to people who are across the Commonwealth. Some people in different counties have larger and greater access to resources like legal aid, and some counties simply don't. And so we're seeing a lot of pardon projects, a lot of more legal aid organizations popping up across the Commonwealth to really help folks get access to second chances, get access to the documentation they need, but also provide education to people in the community to let people know that this actually exists in Pennsylvania. A lot of people don't even know that they can apply for clemency. So we're really trying to make sure that that education piece is involved in all of the work that we're doing.
Well, I'm sure you're no stranger to the notion that there's been this cry out here that, the marijuana industry is making and creating millionaires every day. Meanwhile, folks are still hamstrung and burdened by marijuana convictions. How would you contextualize that in terms of where we are as a state in Pennsylvania with respect to some of maybe of our neighboring states who are maybe doing a better job at this restorative justice thing?
Well, I mean, if you look at some of our neighboring states, you see that marijuana has been decriminalized in some of the neighboring states. Some neighboring states have actually legalized marijuana use for not just medical use. They've also legalized it for recreational use. Some of our neighboring states also allow people to grow their own marijuana at home, which again, simply makes sense, right? So when we're looking at clemency, when we're looking at legalization, we do need to look at this from a broader picture. A lot of people through our medical marijuana program, it's unattainable. It's expensive to buy product. It's expensive to go to the doctor and get certified. It's expensive to pay the state every single year. And so we need to make sure that when we're looking at how we can have other people be able to have access to marijuana, that it's fair, equitable, accessible, and that the people who are able to benefit from this are largely the people who have been targeted and harmed by this from the beginning. And so we need to look at that and make sure that all of these things that we do, all the legislation that we try to pass, really does try to look at how we can try to access and repair that harm that has been done. And when you look at New Jersey, folks in New Jersey over 21 are going to be able to legally buy marijuana this week. So it simply just makes sense that Pennsylvania should be doing this as well.
Right. Thank you for that, Madam Secretary. We'll definitely come back to you, but I want to continue to expand this amazing panel and offer our audience introduction. Next, I want to bring up Representative Chris Rabb, like rabble-rouser, because he's been one of the leading spokespeople, legislators on the issue of medical marijuana expansion and full adult use expansion. He's been also one of the leaders on restorative justice and ensuring that criminal justice reform is at the heart of how we introduce marijuana to our state and our Commonwealth. So without further ado, can you give us a little bit a sense of where we are in this fight, Representative Rabb, where we probably should be offering some of that similar context the Secretary just offered, and then what's the course forward in a unified fashion? Thank you.
Thank you, David, and thank you, Madam Secretary, for your remarks and your leadership. So I'm a founding member of the Cannabis Caucus and the author of a number of bills related to cannabis, on cannabis policy, primarily but not exclusively on medical cannabis. And it's both professional and personal that I do this work. I am a medical cannabis patient. I suffer from PTSD, and medical cannabis has been the only thing that's worked for me. And I'm appreciative of the fact that it is legal, despite the Secretary's points that it is far from easily accessible or affordable to most Pennsylvanians. Over 500,000 of us have chosen to apply for cannabis patient cards. And every time that we use them, every time that we legally ingest medical cannabis, it is at our peril due to the misalignment between the current state law, which leaves a lot to be desired, and federal law that still prohibits the use of cannabis. And that's something I'm really trying to rectify. There's only so much we can do on the state level until the feds get their act right. But there are certain things that we can do to make us safer for those of us who are legal users of cannabis, and ultimately move us towards adult use cannabis. And I use the terms cannabis and adult use versus marijuana and recreational, because when grown folks say they're going to drink, they don't need to say what reason they're drinking. They're drinking because they choose to, because they're grown. Right. And it's about adults making decisions for themselves, however they choose to use it. If it's legal, it's their business. So I tend to use the term adult use, and I use the term cannabis because words matter. We're talking about a plant here that has been criminalized largely for racist and capitalistic reasons 85 years ago. And they used Black and Mexican men as the boogeymen for this plant. And we've been dealing with the racist war on drugs ever since. And now when there is finally some bipartisan effort and understanding that adult use legalization is the future in the short term, it's largely for the benefit of the 1%. And it's benefit of folks who are already wealthy, who are disproportionately represented in elite circles, and at the expense of the continued marginalization of BIPOC communities. And so when I talk about cannabis policy, I look at it through the lens of social equity. You cannot talk about cannabis without explicitly referencing white supremacy and racial justice, because we would not be here if it were not for those issues. And how we move forward is going to be only as good as our knowledge and our acute attention to the history that has informed where we are. And I think that is to not be explicit about the roots of the criminalization and the prohibition of cannabis will get us to a place that may not be all that much better than where we are now, because it will still further inequity based on socioeconomic status. I am confident that we will have adult use cannabis. I think what that looks like, though, is the bigger issue, because you can do something very poorly for the right reasons. You can do something very well for the wrong reasons. And having worked in Harrisburg now for 3 terms, I'm not quite yet at the level of confidence I have to believe that my colleagues will do it right. But ultimately, the public has a great influence on who we elect and how we speak up when these policies are enshrined into legislation and ultimately enacted into law.
I didn't want to interrupt that thought, but that was going to be my follow-up question. How are you seeing some of the machinations that are going on in the General Assembly? Bipartisan work around criminal justice reform being done simultaneously, when you have 2, I believe, adult use bills that are being sponsored by Republican senators. Does this give you any confidence that the right folks are at the table to kind of make legislation work for Pennsylvanians?
No, not particularly. So if you believe that the only way to process legalization is tying cannabis revenue to law enforcement, then we're not actually going to improve anything. Because if you're a hammer, everything looks like a nail. And if you believe hammers are the only tools that have any value in a toolkit, and you don't know what pliers look like or a screwdriver, I'm not.
But not to interrupt, in terms of the approach, isn't it a little softer than a hammer? Maybe it's an electric screwdriver in this day and age. They were kind of approaching it in a little bit more sophisticated way, particularly around in this conversation around restorative justice. Has there been conversation about what that looks like for the people who have been affected by marijuana legislation in the past, and how they're brought into this new world as government's now legislating it and even in some cases taxing it?
Well, look, ultimately you can talk about addressing the impacts in the carceral realm of things, which is important, very important. But the challenge with it is a couple of things. One is, if you look at this as a boon for tax revenue to then fund all kinds of projects that are deeply inequitable, then it's fruit from a poison tree. Secondly, if you look at racial equity, if you look at a fairness approach to this, and you only look at it through the criminal justice system, then that suggests that, you know, the majority of Black and brown folk are in the system, and we're not. We're overwhelmingly and disproportionately represented. That is true, but most of us do not have criminal records. And what it says is it creates a very problematic narrative that the only way we can provide justice for Black and brown folks is addressing folks with criminal records, when the majority of Black and brown folks do not have criminal records. And what about them? What about all the folks who are on the wrong side of the racial wealth gap? We're creating an extraordinary amount of wealth if we don't have the entrepreneurial justice associated with this, irrespective of the status of the Black or brown person regarding a criminal record. Then we are basically saying the only folks who, that the only kind of harm that has been done to Black and brown folk is by putting them into the criminal justice system disproportionately, when in fact the harms have been extraordinary, if only through tax policy, if only through all the different ways that systemic racism has worked, even if it hasn't landed us on the wrong side of the law. And we have to look at equity in a lot more nuanced and comprehensive way than how most of my colleagues in Harrisburg are looking at it.
Well, that's a fair point and well accepted. I'm going to expand again the panel, our dynamic panel, and pivot next to the executive director of the Pennsylvania Cannabis Coalition, Meredith Buettner. Now, when Representative Rabb referenced the cannabis industry and how it's growing and burgeoning, well, you as executive director of this now growing industry in Pennsylvania are right at the precipice, can understand and appreciate some of the ways that this industry has grown exponentially in the last couple of years here in Pennsylvania, but at the same time can have heard the advocacy and the calls for a broader inclusion into the industry that's making and growing so rapidly fast. So I'd love for you to introduce yourself, Meredith, introduce the PA Cannabis Coalition, and then we'll get into a little bit about, you know, how your organization serves a role in marijuana's impact on the Black community more broadly.
Yeah, absolutely. Thanks so much for having me today. My name is Meredith Buettner. I'm the executive director of the Pennsylvania Cannabis Coalition. We represent the permit holders in Pennsylvania's medical marijuana program. We have over 600,000 patients and caregivers that have registered to participate in the program. It's about 1,800 certifying physicians as well. And our organization works to improve the medical program. We were really instrumental in passing a series of modernizations through the legislature last summer with help from folks like Representative Rabb. And then we spend a lot of time focused on bringing adult use legalization to the Commonwealth. And we do that through the lens of the industry's experience in other states. We've seen other legislatures get pieces right and get pieces wildly wrong. We've seen programs tied up in lawsuits over enacting certain parts of their legislation. And I really view my role and the role of my organization to look at what other states have gotten correct, whether it's in terms of how permitting should be structured, how social justice is worked into the program, where that revenue money should go, and how that should be used. And I am going to be really bullish, but I think Pennsylvania has an opportunity to look at our neighbors in New Jersey, New York, Connecticut, and really get a piece of adult use legislation that gets a lot of these things right that other folks haven't. So that is how I view our role.
That's really helpful. I'm going to ask a couple of elaborating questions if I can. And let's start with just like basic terms of use. Representative Rabb was good to transition us from cannabis, from marijuana to cannabis, and from recreational to adult use. Can you just give us a better sense of what medical cannabis is and what the program is here in Pennsylvania? Again, so we can understand it from its impact on the Black community.
Sure, absolutely. So our medical and our program is called Medical Marijuana Program here in Pennsylvania. I will tell you, my group spends a lot of time trying to advocate on that, and we use the word cannabis when we talk about it too, but the Commonwealth still does refer to the program as Medical Marijuana Program. But our program is accessible to folks that have one of 23 serious medical conditions. Those conditions were determined by the legislature to be those that they felt were appropriate for the use of medical cannabis. That list is able to be expanded through the legislature and through the recommendation of our Medical Marijuana Advisory Board. One of the things folks often suggest as making the program more accessible is eliminating that conditions list and allowing folks to make that decision about using medical cannabis with their doctor. It's, the idea of getting government out of the relationship that you have with your medical professionals. So to access medical cannabis, you have to have one of these 23 serious medical conditions. You meet with a certifying physician, and that you meet with that physician, and that physician helps you decide that medical cannabis might be right for you to treat whatever your serious medical condition is. Those conditions range from PTSD to chronic pain to anxiety to some seizure disorders, and there's a whole series of conditions. It does require, there is a lot of work to get a medical card. You have to register with the state. You have to pay the state's fee.
And what is the state's fee, Meredith?
I believe it is $50 but you also have to pay every year to renew that. You have to pay to meet with a physician initially, and then you have to pay annually to be recertified by that physician. One of the things I'm really proud of that we worked with the legislature on last summer was getting the patient fund up and running more quickly. And recently in the past 2 months, the Department of Health under the Office of Medical Marijuana, they have increased access to the patient hardship fund. So now there is an opportunity for folks that receive, there's a list of state assistance programs that qualify you to get your card for free. And then also like background checks for caregivers and things like that. It eliminated some of those costs. And additionally, the department is working on getting a monthly, they don't use the word stipend, but like a monthly stipend out to patients to help them with the cost of their medicine. So that is one of the ways that, we're working to increase access to the program. Also always trying to look for physicians to participate in the program. We've got big areas of the state that don't have a lot of access to certifying physicians. We were able to work with the legislature through a lot of the COVID-19 waivers to allow for virtual certifications. So that has helped increase access as well. And the medical marijuana program is served by 33 grower processors. And we have the potential for 210 dispensaries throughout the Commonwealth. Right now, we have 150-ish, 160-ish dispensaries open, but you do need that medical marijuana card to be able to access the dispensary.
Thank you for that. Again, we're here to talk about the legalization of marijuana and its impact on the Black community. We're just talking to Meredith Buettner of the Pennsylvania Cannabis Coalition. And I want to stick with Meredith for one final kind of exchange of questions, if we can, because we are talking about the Black community, and you do represent, in large part, those license holders for both grower processing and dispensaries throughout the Commonwealth of Pennsylvania. What has been to ensure that there's cultural competency and some level of inclusion and equity in terms of that ownership model that makes up those folks that run this industry in Pennsylvania?
Sure. So the permitting process here in Pennsylvania tried to get this right back in 2016 when the law was passed. And the point system for applications did have extra points for things like hiring and using, diverse contractors and things like that. Do I think it's something that our program got right? I don't think so. I think this is an area that we have a lot of room to expand on. The Department of Health has several times been interested in issuing additional licenses, which certainly more licenses would allow for more access to ownership, except for if we don't get that permitting process right. If we're still using the same process and, we're still allowing folks to use contractors and then dump them and not really diversify their ownership models and things like that, if we just do what we did the last time around, we're really not increasing access for anyone. I would like to see, as we move to adult use legislation, that the permitting process, and diversity of ownership and different types of licenses, right? Licenses that are easier to obtain, less capital requirements. You'll see some permitting processes require you to have a lease signed before you even get a permit. Like there's things that we can do in the permitting process better than we did back in 2017 when the program was getting started to ensure that we do get this piece right. But if I have to give the process that was used in 16 and 17 an up or down vote for how it followed through on some of the diversity pieces, I'm probably giving it a down vote, just in full disclosure.
No, that's fair. And it's great to have a stakeholder like you at the table recognizing that and the ways that we can improve. I'd now like to introduce the last and final one of our panelists, an expert in many things, former member of the Pennsylvania State House of Representatives and current cannabis dispensary operator in multiple states, a cannabis entrepreneur of the highest right. And he happens to also be an African-American man. So maybe he can shed some light on the conversation and where it's headed in terms of equity and inclusion in this space, but also maybe how you were able to kind of push through an industry that's found its ways to be somewhat restrictive for African-American entrepreneurship. Without further ado, the Honorable former Representative Tony Payton, Jr.
Thank you, David. Thank you. Thank you very much. And thank you for having me. I had a little bit of technical difficulty getting on so I missed the first 8 or 9 minutes of the conversation. I came in when Representative Rabb was talking about.
You're here with us now, Tony, and we just want to hear a little bit about your journey on being a dispensary owner, how you cracked into the industry. You weren't necessarily in the state house when this legislation was being pursued, but you heard the earliest machinations of these kind of conversations while you were there, and then you were able to kind of see the industry evolve a little bit ahead of the curve, and now you're fully in it. Tell us about that journey.
Yeah, I mean, you got to keep trying, right? So part of being an African American and trying to crack into this space is you got to have a lot of resilience. Because you're going to run into a number of roadblocks. And, I'll speak very specifically to a situation in Pennsylvania with the scoring. Sure, they had, extra points for having, doing business with MBEs, but they didn't give you the same level of scoring for Black ownership. So if your application, had a general contractor that, was white, for instance, but you had majority Black ownership, you wouldn't get the required amount of points. And I think that's a bug that needs to be fixed if and when Pennsylvania either expands the medical program or moves to the recreational. But also I could speak very knowledgeably about putting in an application in Maryland, and that process being held up by litigation, and you're holding on to real estate for a number of years. So if you want to be an entrepreneur in this space, you've got to have a level of stick-to-itness, and you got to have some level of capital to kind of play in this space. And I will say that New Jersey, from a regulatory perspective, is probably laid out thus far the best regulations to make sure that local and the small mom and pops get a fair bite at the apple.
New Jersey, as I understand, is coming to market today. Is that not the case? The first day of New Jersey dispensaries opening, I believe, is today.
It's technically on the 21st.
21st
is when the adult use sales will start. They given sort of the first crack at adult use sales to the existing alternative treatment centers, the ATCs. So there are 12 of them currently. 8 of those 12 applied, and 7 of those 8 got approved. And those are all the big publicly traded MSOs that got the first kind of crack at adult use, because they are the incumbent.
Yeah, what does this mean? What does this mean for the African American and people of color actors in this industry? Again, you being a prominent actor in multiple states, whether it be Colorado, Maryland, New Jersey, you have an understanding of how these different states work. But in terms of this conversation today, we're talking about the impact on the Black community. So we've recognized a few things. I think Representative Rabb was clear to say restorative justice can't be all about how these things have affected us from a criminal justice standpoint, but also about the economic opportunity standpoint. Tony, you represent the economic opportunity standpoint as an African American man in this space. I'm curious, what states are getting it right? What states are getting it wrong? What can we here in Pennsylvania do to make sure that we're on the right side of history as we move forward with this?
I would say the majority of states are getting it wrong as it relates to making sure that Black and brown ownership is thriving. I will say that I think we can start the conversation at reparations, and then we can kind of finish it with making sure that access to capital is something that's real for people that want to be entrepreneurs in this space.
And what could you say about kind of like the partnerships, the alliances, and like the mechanics that go into a successful cannabis company that you've now been able to develop? For those that are listening and want to get into the space, I'd love to give them some sense of how they can do that.
So I think cannabis, in its current iteration, is fundamentally markets that are government created and government regulated. So you have to be able to understand how to navigate the regulatory environment from a government perspective. And they're going to put out, a request for applications, and they will tell you exactly what they're looking for. And you have to respond to that and make sure and hope and pray that you get a fair shot, get scored accurately, which, happen, not too often in Pennsylvania, I will say.
Where are the places that Black operators and Black-owned dispensaries are really thriving? Are there states you can point to? Are there programs in place that have kind of gotten it right? Recognizing that you said most of the states haven't gotten it right, but there has to be some glimmering hope out there.
So I would say where's thriving? I can't really point you to a market that's saying that they're getting it right. I think Massachusetts.
I thought I've heard good things about the Illinois market and what they've been able to do.
Illinois is a disaster and has not helped anybody Black.
Wow.
There's maybe 1 or 2 people. So Illinois, for those folks that think that they did that wrong, I would sort of point you to a number of news articles showing you the opposite. You can start to think about Massachusetts and maybe say that the rules that they set up were intended to be helpful. But getting through the host community agreement process turned out to be a lot harder than for most folks to navigate. There are, there are a number of African-American operators in Massachusetts that I know of. There's, 3 or 4 Black operators in Maryland on the dispensary side that are, well positioned. But other states, I'm loath to point to one and saying they're getting it right. They're the example.
Right, right. Well, I think this is actually a perfect opportunity to kind of bring all of our panelists to the fore and start to open up this discussion so everyone can weigh in. You've heard from your various points of expertise or where you're working, but I think this is if we're going to drive towards solutions and a common understanding, it's going to be really important that we're having this conversation together. So various panelists, you all heard the discussion and how we've gotten to where we are now. I want to give an opportunity for our Representative Rabb to chime in first. Now hearing a former member of the State House talk about how dismal it is there any hope in terms of getting this right with adult use and kind of closing in, particularly on the disparities piece? And I'd love for Meredith, if you would, follow up with that, just to talk about how we could expand the industry, create more African-American led dispensaries, even in the program that we have in Pennsylvania. Representative Rabb, and then Meredith, please.
So I actually don't know what percentage of dispensaries in Pennsylvania are owned by Black people, and I'm a legislator. I don't know, maybe Meredith, do you know what that number is presently?
No, and my response to that would be that this is one of the issues we have in the program is there's a lack of data. We don't have that information. So it's actually hard to hold the regulators accountable to the statute and the how the legislature put the program together, because that data is not available, and not just ownership data, but unidentified patient data, employment data. There's 27,000 people working in this industry in Pennsylvania. I don't know how many of them are male, female, Black, white, brown. I don't have that information. Right. And that's not pointing at you, Representative. That's pointing at
I wasn't in office.
No, okay. I know that's pointing at the Department of Health. That's kind of data that would help all of us on this call get this right for our state.
So this is what
I think the answer, Chris, is 0% are Black owned.
All right.
0% of the dispensaries in Pennsylvania are Black owned.
Okay, so I had heard that, but I don't know. As a legislator, I have not been given access to that information from from the executive branch. But the bigger point is both of those points they're complementary, right? Because garbage in, garbage out. You can't have equity without transparency and accountability. You can't do it. And you can't have equity without inclusion, right? So what does an inclusive process even look like? Here's the problem I have. Most of my colleagues can't even define what equity is. They think it's the same as equality. It's very different. It is very different. Equity, if you ground it down to its essence, is fairness. What does fairness look like when you're talking about addressing systemic racism in entrepreneurship, in our economy, in agriculture, in public health, in criminal justice? If you're not able to even feel comfortable saying systemic racism, then you sure as hell aren't going to legislate around it in meaningful ways, right? So garbage in, garbage out. I actually founded the House Democratic Caucus Equity Committee precisely for this point, to just help educate fellow House Democrats about what equity looks like and what does it mean as House Democrats in terms of our legislation, our communications, personnel, legal, procurement, all of those things. It was an unknown thing because it was founded actually not that long ago, but before the whole DEI movement became in and sexy. But my point is this: if you don't know what equity is or understand why it matters and benefits everyone, your policy is going to be crap. I don't know how to make it more plain.
If you're not measuring it, there's no way to change or adjust it, right? So it's like
exactly. What are the metrics?
Right.
Exactly, David. What are the metrics to determine what fairness looks like? So we have to understand the current landscape and the historical context too. So if we say, look, if you ask Madam Secretary, what percentage of folks are Black who have been brought in wrongly in the criminal justice system for drug-related stuff, specifically around cannabis. Well, that population has to be considered when we look at legal cannabis, right? Because it's highly related. We have to look at what are the rates of entrepreneurship, what are the rates of wealth creation, financial wealth creation in Pennsylvania. What is the difference between household wealth between the median and the median for Black households? We have to look at all of these different things to figure out how these factors intersect to meaningfully change people's lives. And if we're not thinking about how this impacts whole communities, and we're just thinking about how many new Black millionaires we can create to shut up the rest of the Black folk who are complaining, who don't have meaningful access to cannabis, then we've already failed.
That's a fair point. Thank you. And it was just announced maybe about an hour ago that the Pennsylvania Physician General, Dr. Denise Johnson, is now going to be named Secretary of the Department of Health. So I think an appropriate follow-up discussion could be with Dr. Johnson and how the Department of Health in the waning months of the administration, I guess another 9 months of the administration, plan to tackle these issues. Secretary Trusty, I want to kind of go back to you if we can. We've talked a lot about, she'll be in our forum, our next forum tonight. Secretary Trusty, I wanted to talk to you as we're talking about this restorative justice aspect of it. There are some states that have said, those who have been convicted of marijuana possession as a crime, you get to the front of the list when it comes to being an operator, being an owner, or working in the industry. And I think Pennsylvania has been much more restricted to say if you have been convicted of a crime, you cannot get a license in this industry. So we have like a little chasm there. How are you kind of stepping in that gap, at least from a point of understanding, to explain how those folks can really be, the most impactful in terms of making this industry not only equitable, but successful, quite frankly?
Yeah, and that's a really, really great point. And we're looking at this process here, right? As you're saying, folks who have been, convicted, some folks are saying, and some places are saying those should be the people at the front of the line, right? That's kind of what we're doing with the pardons, right? We're having people who are applying, who have those convictions, and we're able to expedite those people through. So until we're able to actually change legislation and change our programming and how we're actually giving people access to this space, whether it's as a consumer, whether it's a business owner, as an investor, we're going to be there to try to get people through so that they don't have those convictions on their record. A pardon is a full forgiveness from the state. And once you have a pardon, you can then apply to have that expunged. We can do that until we actually get our legislature to act, but we do need our legislature to act. We should not have to be in the business of constantly saying these people should be given a second chance. Some people we see coming through have weed charges from 30, 40, 50 years ago and have had their lives still turned upside down by having a weed charge, not being able to access better opportunities to take care of their children, not able to actually take their kids and chaperone them on field trips. It's absurd, right? It's actually absurd. And so until our legislature acts and until we can change the way that we do access and make it more equitable, as Rabb said, we'll be here to try to help people get through quickly and have a second chance so that they can participate. But clemency cannot be the only option. We should be able to hopefully eventually be able to pardon folks on a grand scale, on a mass scale, so it's not individualized once we're able to get things legalized. So we'll be here to help until the legislature takes action.
Well, it seems to be a little bit of a volley here between the legislative side and the executive branch. And we all know that the Secretary of Pardons works very closely with Lieutenant Governor, in this case, Lieutenant Governor John Fetterman. As soon as he took office, he did a statewide tour touching into every single one of our 67 counties, talking about the issue of adult use. I'm curious, I know this wasn't in your tenure as secretary, but I'm curious about what you learned from that tour, what kind of has been carried on, and what's going to be the next phase of it, right? You didn't do all that traveling as an executive branch, studying the issue, having conversations with citizens about the issue to not kind of turn that into something. What's the intention to turn that into?
Yeah, I think what was found is that people consume cannabis in Pennsylvania. It's also found that people who don't consume cannabis in Pennsylvania support legalization of cannabis in Pennsylvania. because it just simply makes sense. And I think a lot of people don't realize how many people in red counties support this, how many people on the Republican side, independents support this. This is not a political issue, right? This is an issue about access to medication. This is an issue about access to a plant. And we are making it so much more difficult than it needs to be. What was found is that we should legalize marijuana. That's the bottom line. And we are still here years later, not legalizing marijuana. So what we need to do is make sure that our legislature, again, is acting, but we're also doing so much education and letting folks know that, you know what, people consume for whatever reason it is. And as Rabb said, you don't need a reason to drink. You know, you can go to the bar, have a couple of drinks, drive home, and we trust adults to be able to make the decision on whether they can drive home safely or not, right? We don't say, hey, why are you in here? Did you have a bad day? You definitely, should not be able to drive home. Why shouldn't we be doing that for cannabis as well? It absolutely makes no sense. And that's what was found. And so the next step is, again, we will do whatever we can to expand access to second chances for people who do have criminal records that are holding them back. And we will still advocate for legalization as much as we can, because we don't want to be spending our time trying to work on pardons. People should automatically have those charges removed from their records.
100%. And the tip of that political spear in terms of, expanding into adult use has to be the Pennsylvania Cannabis Coalition. Meredith, how would you gauge where things are right now? What is the Cannabis Coalition doing to see that fight through? And then where can we start to inject, again, that equity conversation, ensuring that African Americans have a seat at every table that's being set, right, in this industry and in this place?
Well, thanks, David. And I do think the best way to get the equity piece right is to move the conversation to the conversation about adult use. We're spinning our wheels trying to go backwards with the medical program and get it done there. We were able to work with the legislature last summer to bring down some of the employment barriers in the medical marijuana industry to folks that have had nonviolent drug-related convictions, and also expanded ownership opportunities through that piece of legislation. But that's not enough. And I don't want to see new permits handed out under these conditions where we didn't get that right, much to, Tony has well-made points there. We did not get that part right. So the best way to ensure that we're having these conversations is, for us to work with folks like Rabb and the equity, the equity caucus to educate folks. And look, I'll be in full disclosure here. I came from a 10-year career in Republican politics before I came to the cannabis world. And I think that's super important, because just like the secretary said, this is not a Republican or a Democratic issue. It's an issue we all need to be talking about. And I think as we do see some Republicans show interest, and we can work to demonstrate to others that this is just the right thing to do for so many reasons, that we are going to get that conversation, continuing to move in the right direction.
Absolutely. Tony Payton, I want to re-engage you in this conversation. You're an advocate for the expansion of the medical marijuana program in Pennsylvania. You advocate on behalf of some of the licensees in that process, and we're very close with that. What have you seen kind of as the industry grew from almost nothing, right, to now we have, whether they're currently license holders or not, you do have African Americans who have gotten into the industry in Pennsylvania, stood up a business, it's been successful, whether they sold off. Give us some sense of those bright spots, if you will.
Yeah, full disclosure, I did represent Alera, which, was majority minority group. They were successful in the application phase in 2017. They were the first super license winner, and they announced an exit in August of 2019. So 2 years, and they sold. I mean, that's the single largest transaction in cannabis in any state. The single largest single state transaction from an M&A perspective in Pennsylvania is to this day, because it's a limited license market, which I think is a flawed premise to begin with, but it is the hottest. It is, one of the healthiest medical markets in the country. although you got to jump through some hoops to get a medical card there. It's a healthy market. Everybody wants to be in it. I think, there's supply issues for the patients, right? Patients can't access their medicine because there isn't enough supply, which shows you kind of the faulty premise behind a limited license market. We need to kind of either expand it greatly or, move to adult use and make sure that everybody and anybody can get their medicine.
Yeah, I'm curious. The question I've had, all this and other industries that are newly regulated, there's always a give back, and I references back to like casinos when the licenses went out for casinos, and there's a certain portion that they have to give back essentially to the community. Is that written in this medical marijuana rule? And how have we seen that manifest in terms of community development, perchance? Anybody who knows can answer that question, please.
Well,
Go ahead, Representative Rabb. I mean, because he could talk about all of the things that are there, even the invisible capital, which he wrote about a decade and a half ago or something like that.
Something like that, yeah. I had no idea how relevant it would be to my current profession. I will say this. If you have a BIPOC majority-owned dispensary, there should be a right of first refusal to BIPOC owners, and inclusive of something that a lot of my colleagues don't think about, which is the ability to allow employers to own their own labor. So I'm a big fan of worker co-ops. I'm on the House Agriculture Committee. Agricultural co-ops, rural co-ops have been a thing for generations. And the predecessors of co-ops are mutual aid societies, which were created by Black folk during slavery. So there's a cooperative economics here that is particularly powerful. So it's not about individuating opportunity for certain Black people, but how does this benefit whole communities? So when you have the ability or a requirement to sell, that there should be a right of first refusal to not just a specific Black or brown person, but communities of folks who could include skilled laborers in that field. And when you look at the benefit of shared prosperity, you look at the benefit of what we call community wealth building, right? The things that matter most. One of the things that got a lot of Republicans on this side was, and this was before my time in office, was they said, look, medical cannabis helps children and other people who are afflicted with awful conditions. And it's the only thing that works. And sometimes it works damn near immediately. And why would you keep children? Why would you keep people who have to deal with this kind of pain from a plant that can save them or radically improve their quality of life? Right? That is a form of community wealth. When you have a sense of well-being, when you care about the quality of life of your neighbor and whole communities, that has great value, not just financial value, but it makes our society more just, more compassionate, and that makes our commonwealth more powerful and better in all the best senses. So when we look at ownership, we have to look at what is the community impact of that, because we have seen that particularly in bad economic times, cooperative forms of ownership have been more resilient than conventional ones. So we need to have those options there. It needs to be baked in, which is why I said earlier, garbage in, garbage out. We need to have those conversations to have that nuanced discussion to improve policy for the benefit of everybody.
Absolutely. Thank you for that point. And I think we're gonna end on that point. I'd love to hear everybody's take on how the emerging medical marijuana industry, soon to be adult use industry, affects the Black community from your vantage point, how it can be improved, how it, what some of the ways that we've fallen short. But that's the conversation we're having today. And I thought that Representative Rabb really was able to kind of focus in on the community. And I'd love for every one of our panelists to kind of have that take on the way out. I'll go to Tony Payton next, if we could.
So can you, I had a little bit of, you cut out.
Yeah, I saw that you were distracted, Tony, but you're taking time away from your answer. So we're talking about how the legislation of marijuana and how its impact on the Black community. Representative Rabb was keen to kind of focus in on how the community should be at the root of all the decisions we're making around this plant. I'm curious, from your vantage point as an entrepreneur, how would you say the marijuana industry has improved the Black community, and how could it if it's not?
So I fundamentally view it as a medicine, and I think it is an unprescribed medicine for far too many people. And I think we need to really figure out the research and development behind this to really dial in the right dosing and methods, because there's a lot of people out there that are hurting from a number of different things. So really focusing in on getting the community its medicine, number one. And I think also, part of that medicine is, allowing people to thrive, financially, and create and build, potential businesses in this space, allowing for that to be something that happens, for the folks that have been the closest to the pain should be the closest to the gain. And we know which communities are over policed. That's not a disputed fact. But I mean, history being what it is, if we know our history, we know that at every turn, the folks that have gotten the short end of the stick have been the people that look like me, you, and Chris, right? And Celeste family. So
you have a longer stick than they did, Tony, as an entrepreneur in the space. We're congratulating you for entering into that New Jersey market and making history, quite frankly. And we'll continue to support you as an entrepreneur in the space. Thank you, Tony. I'd like to next go to Meredith. You're, again, the leader of the industry, the Pennsylvania Cannabis Coalition. You represent those actors who, are doing some good, but could do more, as we said, particularly as it expands. Love to kind of, in your final encapsulation of how the industry has affected and can continue, hopefully in a positive way, to affect the Black community.
Well, that was going to be how I was going to start this. I think the answer is it has to affect the Black community positively going forward. And end of story. That is important. Have we gotten everything right in Pennsylvania? No, we haven't. But I think, to Tony's point, it's hard to point to a lot of markets that have gotten it right. So I think what's important is ensuring the right people have the seat at the table, ensuring we've learned from the experiences of other markets, and listening to our communities here in Pennsylvania about what would help them increase access to medicine, increase access to ownership. Do we need job programs? Do we need just access to capital? What is it that we need? And how can we make sure that the answer is the impact on the Black community is positive?
And finally, Secretary Trusty, can you give us a sense on how the industry has affected the Black community? You're obviously at the perch of, its intersection with criminal justice and reclamation, if you will. But how can the industry do better, and how would you say it's done so far in terms of its impact on the Black community?
Yeah, I mean, we definitely need to increase access. This is a very hard thing for a lot of people to have access to their medicine through our current program, access to actually getting, a medical card if you are outside of those pre-described diagnoses. And so, as far as criminal justice goes, we did see, again, a reduction in people being arrested for marijuana possession. But at the same time, we are still seeing nearly 20,000 people in Pennsylvania a year being arrested. And again, we saw the disparity. We saw the racial disparity. We know who is being arrested much more often for having cannabis. And so we really need to look at criminal justice and how it'll actually improve our communities if we are able to divest resources from going after people who consume cannabis and using those resources to help bolster and support our communities across the Commonwealth. This is, again, not just an issue that impacts people in one county. This impacts all of us. And so we really need to make sure that we are looking at how we can reduce people going into the criminal legal system for simply using a plant, and then go from there.
I think that's an incredible way to stop this conversation. This has been an amazing conversation for me. I've learned a lot. hopefully our audience has been engaged throughout. I want to bring to the fore our organizer, Nicole Magruder, and thank her for putting together this panel. Again, I've learned so much. And also want to announce that Secretary of Health, Dr. Denise Johnson, is going to be on a future program here just in a few moments. So Nicole, thank you again for bringing us together, and please offer us your closing words.
Yes, thank you so much, Mr. Dix, and esteemed panelists, for sharing your wealth of knowledge with all of our attendees. This was an extremely powerful conversation, and I think it's worth watching again. So this has been recorded, and it'll be uploaded for on-demand viewing for the remainder of the week. It'll also be uploaded to our YouTube channel, Disrupt to Build Up, at the end of the week. And for those of you who are watching on social media, please be sure to register for the conference, and you can get the full experience. Go to blackhealthmatterspa.org to register and watch the sessions from within the conference platform. This is a week-long conference, so we hope that we see you later on during the week. Coming up next, we do have our Laughter is Medicine comedy show with 2 live comedians that starts in a moment. And that's followed up by our State of Health Policy forum, in which we have many legislators from the Legislative Black Caucus on, and it'll be moderated by radio show host and thought leader, Mr. Charles Ellison, in addition to Dr. Denise Johnson. So thank you again, panelists, moderator, and attendees for being a part of our afternoon. And everyone have a very good evening. Bye-bye.